Hello, I am Nurse Cam from Heyday Clinic, joined today by Dr. Jim, also from Heyday Clinic, and we're going to be speaking to you today about clinical endocannabinoid deficiency, what it is, what it appears to do, and how we may remedy it. So, Dr. Jim, take it away. What is CECD?
Hi, Nurse Cam. Clinical Endocannabinoid Deficiency Syndrome is a term that was coined by Dr. Ethan Russo in the early 2000s, who's a very well-regarded neuropharmacologist and neurologist. So the theory behind clinical endocannabinoid deficiency syndrome is that they're, like a lot of other disease states, are a deficiency of certain neurotransmitters, depression might be related to low serotonin, or Alzheimer's disease might be related to low acetylcholine, or Parkinson's disease might be related to low dopamine. There is likely diseases out there or syndromes out there that are related to low levels or low functioning endocannabinoid system. As we know, the endocannabinoid system is involved in a myriad of different processes within the body. So primarily, these are things around regulating pain, regulating sleep, regulating stress, regulating mood, regulating digestion, regulating immune function, and a whole host of other processes. So if someone theoretically had a deficiency or a dysfunction of the endocannabinoid system, they would start manifesting symptoms related to these core pillars of the endocannabinoid function. So Dr. Ethan Russo postulated that there would be a syndrome of certain symptoms, so that they would have things like a hypersensitivity or hyperalgesia, where they were finding that normal stimuli were causing an exaggerated response. They might have difficulties managing things like stress. They might have issues with their sleep. Also, it would have to be syndromes that were not better diagnosed by other pathogenic sort of markers or laboratory sort of studies. So they didn't have a clearly defined diagnostic criteria in the first place. And there was often an overlap between these different sort of comorbid states as well. So initially, the first clinical endocannabinoid deficiency states that were postulated were irritable bowel syndrome, fibromyalgia, and chronic migraines, because of those key features on the history.
Dr. Jim, what conditions are related to CECD and why?
Mm-hmm. So as we mentioned, the first syndromes that were seemed to fit that picture of clinical endocannabinoid deficiency syndrome were the chronic migraines, the irritable bowel syndrome, and fibromyalgia. And it was because at the time, or as now, we didn't have a clearly defined understanding of why these conditions existed. And they did have those similar symptoms. So difficulty managing sort of stress, or stress being a major trigger for the other symptoms that might occur. There was a pain element around it that seemed to be out of proportion to any sort of tissue damage or pathological process sort of going on. They did seem to run in clusters and coexist. But these were the obvious ones. These are the obvious clinical endocannabinoid deficiencies. So this theory was postulated in the early 2000s. Over the last 20 years, this framework has been applied to other different sort of conditions. So other things that have come out that have shown to have a strong correlation to a deficient or a dysfunctional endocannabinoid system, things like endometriosis, and then other disorders that like anxiety, depression, PTSD, can all show endocannabinoid dysfunction. So whether these other chronic diseases have a primary clinical endocannabinoid deficiency as the triggering factor for the development of these diseases, or whether these diseases cause a secondary deficiency in the endocannabinoid system is yet to be determined. But what we do see is that an upregulation of the endocannabinoid system in these disease states or syndromes makes a significant difference to the health and well-being of these patients.
And I will say that in terms of some of the actual, the measured endocannabinoids within these conditions, in the case of chronic migraines, we have markedly lower levels of anandamide in the cerebral spinal fluid. When it comes to endometriosis as well, women presenting with endometriosis generally have lower levels of CB1 receptors in their endometrial tissue. And that impaired ECS functioning has been suggested to lead to an unregulated growth of endometriosis tissue and then significantly higher levels of pain, severe pain as well. I'll also touch on autism spectrum disorder. So children with autism spectrum disorder, there's been notable deficiencies of anandamide, palmitoyl lethanolamide, and oleolethanolamide when compared to their neurotypical controls. And then when it comes to things like inflammatory bowel disease and irritable bowel syndrome, so fluctuations in ECS tone there have been thought to contribute to that. And one study found that a genetic variation associated with colonic transit time affecting ECS metabolism was present in diarrhea-predominant IBS patients. And then, overall, though, research on CECD in humans is still in its early days. So numerous studies on rodents demonstrated that rodents with a deficiency of 2-arachidonyl glycerol were more likely to display that low stress resilience, some behavioral abnormalities or alterations, analogous to certain mood disorders such as anxiety, impaired reward pathway activation, compromised fear extinction, or alterations in structural plasticity.
That's right. So this is a system that's extremely difficult to study in a lot of senses, and I wouldn't be surprised if a lot of different conditions start to fall into this clinical endocannabinoid deficient sort of state. And there is, like you said, there's the hypothetical syndromes, but then there's also emerging evidence in all of these other sort of areas, and also in things like Parkinson's disease, multiple sclerosis, Huntington's disease, motor neuron disease, all seem to have an implication of the endocannabinoid system in the development and worsening and progression of their disease states as well. So it's something that I think we should all be keeping a close eye on.
Certainly. And then when it comes to the actual causative factors behind developing an endocannabinoid deficiency, not only is it the endocannabinoids, where there's multiple aspects of the system that it's a set of ingredients that go into facilitating the creation of an endocannabinoid. We also have, the various expression and density of CB1 and CB2 receptors, whether they're expressed, in different regions of the body, such as that, going back to the endometriosis and that low expression of CB1 receptors in that endometrial tissue. And our genetics play a huge role in ECS function as well. So a wide range of clinical outcomes show that there are polymorphisms in ECS genes, particularly in the coding for CB1 and CB2 receptors and for the enzyme FAAH. So the clinical outcomes associated with some of those ECS irregularities include schizophrenia subtypes, alcohol dependence, body mass index, central obesity, ADHD and PTSD, happiness baselines, serum lipid profiles, and then the risk of cyclic vomiting syndrome and things like cannabis hyperemesis syndrome. And so it is very much, the chicken or the egg. Does a deficiency in these things predispose somebody to potentially develop one of these conditions or symptoms, or does it go the other way around?
Well, I think it probably goes both ways, Cam. So if someone has a genetic predisposition to developing clinical endocannabinoid deficient states, and then they are exposed to trauma or stresses, their endocannabinoid system is placed under increased sort of duress, and over time, as it is unable to keep up with the demand that is placed upon it, it will become deficient. And once that deficiency is noticed, so every person is probably going to have a different sort of level or a different threshold what their endocannabinoid system can tolerate in regards to these external or internal stresses. But once that threshold is met and they're not nourishing the endocannabinoid system with the right types of activities or lifestyle or other sort of supplements, then they will start developing, increasing symptoms. And I see this a lot of the time in clinical practice where patients have been able to manage their life stresses, their disease up until a certain point, and then something just happens and they deteriorate and things seem to snowball and the disease gets worse. They get issues in multiple other areas of their health, and they end up sort of struggling in these many facets of their life. And I believe that's the point where the endocannabinoid system is no longer able to keep up with the demands placed on it. So in theory, all chronic disease is going to have an element of clinical endocannabinoid dysfunction, or if not an obvious dysfunction, all chronic disease could be better managed if the endocannabinoid system is taken into consideration in regards to managing these patients' long-term symptoms.
All right. And then we've touched on this briefly, but what are some of the signs and symptoms of an endocannabinoid system deficiency? Because we've talked about some of the, the more observable or notable outright conditions, but what about the symptoms potentially leading up to that moment?
Yeah, well, look, as you're aware, the endocannabinoid system is heavily involved in so many different sort of regulatory processes within the body. But a well-known sort of mnemonic in regards to the endocannabinoid system is eat, sleep, relax, forget, and protect. So these are all very important mechanisms for our body, and they involve things like stress regulation, pain regulation, mood regulation, cognition, memory, digestion, inflammation, immune function, motor function as well. So most physiological processes within the body have some element of endocannabinoid system involvement, but certain areas are more tightly regulated by the endocannabinoid system. So when people start developing issues with their sleep, they feel like they can't handle their stresses as much as they have in the past. Pain symptoms seem to be getting, stronger and on top of them and correlate with digestive upset, reflux, IBS type symptoms. That's when the endocannabinoid system is really struggling to keep up with the demand placed on it. And that may or may not sort of develop into an anxiety disorder or a depressive disorder or a pain disorder. It might recover because, the stresses are no longer there placed on that person, or that they, change their lifestyle and their habits to help support that endocannabinoid system. But it's those areas that are I guess, the signposts of endocannabinoid dysfunction.
All right. So then how do you test for it? Is there an easy testing method?
I wish that was so. It'd make my life a lot easier. But the endocannabinoid system is a system that works on demand as required. The endocannabinoids are released by the cell wall. They act locally. They are taken back inside that cell and broken down locally as well. So there's no endocannabinoid gland that's circulating, these endocannabinoids to distant parts of the body. It is all happening in this local process that happens, when it's needed. So to measure levels of endocannabinoids in the blood is really quite difficult. The best indicator of an endocannabinoid dysfunction is increase of the cell receptors, because that's showing that the system is trying to hold on to as much endocannabinoids that are being produced. But really, without doing invasive testing of tissue biopsies, lumbar punctures, it's really difficult to tell from a pathological or a laboratory sort of process. So it does come down to the history more than anything. So the history is so important. And it's when people are really sort of getting issues in multiple different areas that may seem unrelated, but really probably do have this common link. And so when treating someone with chronic pain, you're not just treating their pain, you're treating their their sleep, their anxiety, their well-being, and all of these other areas. And that's what makes cannabis such a useful tool in these patients as well.
All right. So just to recap, then for a lot of these conditions, we're lacking the pathogenic markers that would generally make a condition more easy to identify. A lot of these conditions is probably why they've been labeled as, psychosomatic at some point in time, or, those waste paper diagnoses. A lot of people struggling to adequately represent themselves and be an advocate for themselves when clinicians, don't have the tools to actually assess what's going on. So it really is a gathering of all of that subjective data to paint a comprehensive picture of that individual, and then within that picture identify little spots where certain endocannabinoid system dysregularities could be making an impact.
Very, very much so. So yeah, and with all those people as well, there might be primary areas that you focus on, but you do want to look at the whole picture, and that individual's experience is the most important component in regards to testing for this type of deficiency.
And then when it comes to treatment, how do you treat this deficiency?
So we are treating the ECS. We are trying to sort of upregulate and tonify the body's endocannabinoid system. And there are many different ways we can sort of help to support this system as well. So, cannabis, which we'll talk about in a second, is one way if used correctly. But a lot of lifestyle and nutritional factors are going to make a significant significant impact on this system. So first off, the endocannabinoids themselves are produced from fatty acid precursors. So we need to have the right balance of omega-3 to omega-6. So the standard Australian diet or the standard American diet, the ratio of omega-3 to omega-6 is generally around 1 to 20, up to 1 to 40 in some areas, but the ideal ratio is 1 to 2. So 1 part omega-3, 2 parts omega-6. We're getting all these omega-6 essential fatty acids, which are still essential fatty acids from our vegetable oils, from all our fried foods and all of our prepackaged sort of products. So what we want to do is we want to minimize those types of products, and we want to maximize the more omega-3 rich products. So things like eating wild-caught fish, eating sort of gamey wild-caught meats, pasture-raised eggs, nuts and seeds that are rich in omega-3 like flax, hemp, chia seeds. They can all be of benefit as well. And then otherwise in the diet as well, we want to make sure that we're eating real foods, minimizing processed and packaged foods. The gut microbiome has a really strong interaction with the body's own endocannabinoid system. So we want to care for this other ecosystem within our body. So the best way to do that is to have a diverse microbiota, and the best way to maintain a diverse microbiota is to eat a wide range of fruits and vegetables, because that's where all the prebiotics are, the food for those microbacteria sort of come from. So eating predominantly, eating a lot of plants, getting a lot of spices into your diet, because they're also plants. A lot of those spices have their own sort of medicine. So things like beta-caryophyllene that comes from a lot of spices, which is a particular terpene. It also activates the CB2 receptors within the body, so that can help support and supplement that system. And then things like exercise is shown to have great benefit in regards to helping support the endocannabinoid system, but that exercise needs to be exercise that you enjoy. Part of the benefit is from the enjoyable nature of it. Aerobic exercise seems to be slightly better than more intensity-based sort of exercises, but the enjoyable element does need to be part of it. So you need to be working with someone rather than prescribing a specific sort of exercise plan, which is something that they would hate doing. It needs to be finding activities that they enjoy and then getting them to do more of them. Also, social connection, having community, connecting with nature, connecting with your loved ones. All of these things have been shown to be really beneficial. Things like osteopathic treatments, acupuncture, massage, where you get that physical touch and connection. Rebalancing that endocannabinoid system can be of great benefit as well. So it is a very holistic approach. The beautiful thing I think about the endocannabinoid system as well is that generally the things that make it supported are the things that make you feel good. So if you're doing things that make you feel good, then you're generally on the right path. Look, we all have some guilty pleasures as well. We want to minimize those guilty pleasures, but when we do those things that we know might be bad for us, slow down, savor them, enjoy every bit of it, and maximize the pleasure rather than feeling guilty about it and scoffing it down. And even with these guilty pleasures, you can support and upregulate this system. But we also have cannabis as well. So cannabis is an extremely valuable tool in regards to supporting the endocannabinoid system. So cannabis, as you know, is a complex herbal medicine. It's not just one thing. So THC works very similarly to the body's own anandamide as a partial agonist. So if you have a clinical endocannabinoid deficient state, so you are lacking endocannabinoids, and you add in this phytocannabinoid in there, it can almost be a supplement for this system. So you don't need to be using THC in a way that makes you feel sort of intoxicated, which is kind of like you're having a endocannabinoid surge. You just want it there in low levels to support that system. But saying that, for people who don't have a significant endocannabinoid dysfunction and they overuse THC, they can actually start suppressing and down-regulating that system. So it's all about finding the balance there. CBD can be another very safe tool for supporting that system as well by reducing the breakdown of the body's own anandamide. The CBD also competes for those fatty acid binding proteins that carry around our own endocannabinoids, which mean they last in the system for longer as well. So cannabis can be a great tool, but it's definitely not the only tool that helps support this system.
All right. So in conclusion, we have the endocannabinoid system, which is in itself essentially a biochemical feedback machine. It helps to translate that external experience into the internal response that keeps us balanced. And when we have dysfunctions or deficiencies in those biochemical messengers, the signals that they're supposed to send to maintain those homeostatic functionings are essentially cut off. And so we have dysregulated homeostasis. And we have a variety of tools that we can use to hopefully supplement and mitigate those effects, predominantly if talking about phytocannabinoids, to use some of those deficiencies. We can also supplement with endogenous cannabinoids, such as PEA and OEA. And then, of course, all of the lifestyle factors and dietary modifications, and then doing things you love, because the ECS responds to things we love too.
Very much so. And I think as Dr. Dustin Sulak says, it's about activating your inner pharmacy. So rather than having to go for all of these exogenous compounds, we do have in a lot of ways what we need on the inside. We just need to find the stimuli to activate them.